Many people think that they do not need genetic testing before a pregnancy because they do not have any genetic conditions in their family or because they have other healthy children. This episode will explain why this is not true, along with what you need to know to decide if genetic testing is right for you before a pregnancy. We will also discuss what your family history can and cannot tell you about predicting health risks to your children. For those of you who are new here, I am Kendra, a board-certified genetic counselor who specializes in prenatal care. I produce informational videos about prenatal genetic testing and how to navigate unexpected news in pregnancy. If you do not want to miss a future video, press the subscribe button now. So what should you know about your family history? Your family history can provide information about whether you are likely to pass on certain conditions to your children. This is because family members share some amount of genetic information. Collecting information about you and your partner's family history is the first step to learning more about possible risks to your children. The American Medical Association created a helpful form to gather information about your family history. You can access the form in the link below. You only need to collect information about relatives that are related to you or your partner by blood. Focus on the following relatives: siblings, nieces, nephews, parents, aunts, uncles, first cousins, and grandparents. Look for the following health issues: birth defects that required surgical repair as an infant or child, such as a cleft lip or heart defect. If the specific cause is known, write that down. Known genetic conditions in the family, such as sickle cell disease or cystic fibrosis. Chromosome differences, such as Down syndrome. 2 or more pregnancy losses in any one family member, and whether there's any history of stillbirth or infant death. If the specific cause of that death is known, write that down. If you identify any of these issues in your family, meet with a genetic counselor to discuss your family history further. A genetic counselor can talk with you about if any specific genetic tests are recommended based on your family history. They can also help you make an informed decision about whether genetic testing is right for you before a pregnancy. You can ask your healthcare provider to refer you to a genetic counselor. You can also find a genetic counselor near you in the United States and Canada at the following website. You might be wondering, well, why can't my family history tell me about all possible risks to a future child? Family history cannot predict all possible health risks to a child because some medical conditions are caused by environment or lifestyle factors, such as diet or tobacco use. Other conditions like diabetes or mental health conditions are caused by a combination of genetic and non-genetic factors. Another reason family history cannot predict all possible health risks to a child is because some genetic conditions can be passed down silently through families. This means there may be no sign of the condition in the family and no other family member who is affected with the condition. An individual can carry a genetic change in their blood, but have mild or no symptoms of the condition. They can pass on this genetic change to their child, which may cause the child to be affected, depending on what the child inherits from their other biological parent. In addition, some genetic conditions are not passed down by blood, but they occur by chance due to an error in the egg or sperm at the time that a baby is conceived. Down syndrome is an example of a condition that often happens by chance at the time that the embryo is forming. For this reason, testing for Down syndrome is available once there is a pregnancy to test. Keep in mind that there are exceptions to this. If you have a family history of a chromosome condition, or if you and your partner have had 2 or more pregnancy losses together, speak with a genetic counselor about whether you and/or your partner should have chromosome testing performed. I mentioned earlier that some conditions can be passed down silently in a family. So how do you know if you carry a genetic condition? A test called carrier screening can be performed to screen your DNA for certain, but not all genetic conditions. Carrier screening can be performed on a blood or saliva sample at any time before or during a pregnancy. So what does carrier screening test for? Carrier screening can test for a few genetic conditions or more than 500 genetic conditions that people can silently carry. Most carriers have no symptoms of the condition. However, their children may be at risk to develop the condition. The symptoms of these genetic conditions can range from mild to very serious and include learning disabilities, birth defects, medical issues such as seizures, vision or hearing loss, or a shortened life expectancy. Some of the genetic conditions included on carrier screening are treatable, but others are not. Check with your healthcare provider about which conditions they recommend or offer carrier screening for. Meet with a genetic counselor if you have questions about carrier screening that cannot be answered by your provider. You may be wondering, well, how common is it to be a carrier of a genetic condition? This depends on a number of factors, including your family history and your race or ethnic background. Even without a family history of any specific genetic condition, the chance for you to be a carrier may range from less than 1% to up to 10% depending on the specific condition. Some people think that prenatal ultrasound will detect a pregnancy affected with a genetic condition, so testing before a pregnancy is not needed. Not all genetic conditions can be detected by prenatal ultrasound. Ultrasound is good at detecting major birth defects in a fetus, which are structural changes that affect different parts of the body, such as the heart, brain, or kidneys. Many genetic conditions are not associated with major birth defects. Other genetic conditions can cause symptoms that can only be detected after birth or in childhood, such as learning disabilities. You might be thinking, well, does insurance cover carrier screening, or how much does it cost? Most insurance companies cover the majority of the cost of carrier screening, but you can check with your specific insurance provider. If insurance does not cover this test, carrier screening typically costs a few $100s. Some labs that perform carrier screening will offer financial aid to people who qualify, so ask your healthcare provider or the company performing the test about this option. How do you decide if genetic testing before pregnancy is right for you? Genetic testing before pregnancy is optional. It is important to consider your own values and beliefs, including how you may use the information you learn from genetic testing. If there is an increased chance to have a pregnancy affected with a genetic condition, this may impact where a person receives medical care during a pregnancy, which types of doctors are involved in their pregnancy care, and where they ultimately deliver their baby. Some people may decide not to have biological children if they learn they are at a higher chance to have an affected child. Others may choose to use a sperm, egg, or embryo donor to reduce the chance of having an affected child. Another option that can be considered is adoption or foster parenting. Other people who learn of having an increased risk to have a future child may choose to pursue in vitro fertilization or IVF and do genetic testing on embryos. This can reduce the chance of having a child affected with a specific genetic condition a person carries. It is normal to feel some degree of anxiety or worry as you think about the option of genetic testing before pregnancy. Some people find it helpful to discuss this decision with a trusted person, a healthcare provider, or a genetic counselor. If you have genetic testing before pregnancy, you might wonder, do I need genetic testing during a pregnancy? The simple answer is yes, if you desire additional information about your baby's health. Genetic testing during pregnancy provides different information than you can receive prior to the pregnancy. Stay tuned for an upcoming episode about what you need to know about genetic testing during a pregnancy. For one-on-one support, please visit allay-life.com. In closing, please support our community by liking and subscribing to this channel. I would love to hear from each of you. If you'd like, share a comment below about your own journey or topics to cover in future episodes. Lastly, for free informational and support resources, check out my website at allay-life.com. With love and light, see you next time.